So cervical cancer which affects the cervix, that means the mouth of the uterus. Population based screening is very important in these patients. It's a simple pap smear test which has to be done once in 3 years. Best prevention is by human papillomavirus vaccine, and it is of 2 doses if it is given at the age of 9 to 14 years. It's a highly curable cancer and more preventable cancer. Hi, this is Dr. Satish Pawar, Chief Surgical Oncologist, Kaizen Hematology Network, Hyderabad. Today, let us talk about preventive oncology. Why preventive oncology is becoming the necessity of this hour is because there will be better survival if the cancer is detected in early stage or in a pre-cancerous stage. Especially once we talk about the commonest cancer in our region was cervical cancer earlier. Now the breast cancer is slowly taking over the cervical cancer. So let us speak about cervical cancer because this disease is still very prevalent in rural India. So cervical cancer is a cancer which affects the cervix, that means the mouth of the uterus. So this cancer, once the cervix, if from the normal cervix to the frank cancer, this itself takes around 10 to 12 years. That means there's something called CIN in between, that is carcinoma. In there, the changes which occur in the mucosa of the cervix, slowly that changes, the different cells that are called metaplastic cells, and they change into cancerous cells. So this span is about 10 to 12 years, and we have ample opportunity to detect the pre-cervical cancerous lesion in these 10 to 12 years. So any high risk individual who are more prone for cervical cancer, whose hygiene is less, who have multiple children, who have multiparity, so all these people are more prone for cervical cancer. So that's why population based screening is very important in these patients, because what we do is it's a simple pap smear test which has to be done once in 3 years, and if you combine with HPV DNA, then this test can be done once in 5 years. Hardly it costs around 500 rupees for a pap smear to be done. Medical college or a government hospital, it is done free of cost. Hence, every individual who is more than 50 years of age has to undergo these tests every 3 years. Apart from that, the best prevention is by human papillomavirus vaccine. The HPV vaccine is available in our country as well, and it is of 2 doses if it is given at the age of 9 to 14 years. The school going kids have to be offered these vaccines, where they take first dose and after 6 months the second dose is given. So studies are being done whether single dose also is sufficient in low socioeconomic countries, where countries like ours, where if the government has to bear the cost of the vaccine and the government has to bear the cost of the prevention, that is the pap smear, then the cost has to come down drastically so that the larger population receives these vaccines and the prevention, that is the screening tests. So hence the WHO is recommending that studies be done, population based studies be done who are between 9 to 14 years, and single dose can be given to this. So it is an ongoing research, but most probably it will be passed in a few years time, and if you are lucky enough, then we can get away with a single dose of cervical vaccine. Apart from that, the common varieties of the HPV virus which causes cervical cancer, those virus, the recent vaccine which has come up has a greater coverage, that is called nanovalent vaccine, has a greater coverage and is more efficacious. So hence single dose should be sufficient in the future, and studies will definitely show that. Hence identify these individuals who are high risk for cervical cancer, and especially in women, they are shy, they don't show the symptoms, and most of the times the cervical cancer are identified in a very advanced stage, that is 3rd stage or a fourth stage where survival itself comes down drastically with even if we treat them. So if they are detected in first and second stage, then the cure rate is almost to the tune of 85 to 90%. Hence, it's a highly curable cancer, and definitely it's a more preventable cancer. And there are countries where the vaccination is being followed, the population based vaccination is followed from almost 10 to 15 years now, and the cancer, cervical cancer is almost being eradicated in those countries, and we are still far away from them, but yes, hence we should always try and achieve that in our country as well. Thank you.